Good morning, everyone. Thanks for tuning in, and if you're watching this as a replay, thanks for watching this. Today we're going to talk about insurance opportunities, insurance options for students on OPT. The ISS office used to automatically enroll students on OPT in our student insurance plan. As of December 31st, that's going to change. Students are going to have the opportunity to self-enroll in one of many different plans. And we encourage you to ask your employer about what kinds of insurance plans they offer. That's probably going to be your best bet. If you don't have an insurance option through your employer or it's not enough, you could also look at the marketplace. There's lots of independent insurance opportunities out there. But we are also working with Gallagher, who is the provider of the student insurance plan, to give a variety of options for students on OPT as well, in addition to employer or marketplace plans. I'm going to turn it over to Dean Sandonato and Eunice Sakam to talk about what those options are, and we hope that you can find at least one of those options that'll work for you. So, thanks.
Thanks, Darby.
Yep.
So today we're going to talk about the OPT insurance plan offerings that we have available through GallagherStudent.com. Before we get started on the actual insurance, I felt it was important to first go over what the requirements are here for J1 versus F1 visa. And I wanted to first start by talking about what the J1 visa requirement is for an international student or scholar here in the United States. The U.S. Department of State has a minimum requirement while you're here in the United States, and this is a list of what is required of you. You have to have at least $100,000 per accident or sickness. That's the first thing you typically see on your schedule of benefits. You also need to have at least $25,000 worth of repatriation of remains. You have to have $50,000 worth of medical evacuation. Your deductible can't be higher than $500 per accident or sickness. And lastly, if you're going to be buying an insurance policy in the marketplace or online, you want to make sure that it's underwritten by an insurance carrier that has an AM Best rating of A- or better. All of the plans that we're going to talk to you about today exceed all of these requirements that you see here. These are the bare minimum requirements. We don't recommend you get the bare minimum coverage. We always recommend that you get higher coverage than that. If something does in fact happen to you while you're here in the United States, you want to make sure that you're adequately covered. Now I'm going to talk about F1 and F2 visa requirements. If you're on an F1 or F2 visa, you technically don't have requirements that you need to meet. But as a rule of thumb across the board, colleges and universities recommend that their F1 and F2 students either A, have coverage that's identical to what their domestic students have, or B, coverage that is at least meeting the J1 minimum requirements. So again, we recommend you have a comprehensive insurance policy while you're here in the United States. And on this next slide, we're going to talk to you about what you want to look for if you're buying an insurance policy online. These are the key factors you want to look for. First, an adequate plan maximum. We talked about $100,000 per accident or sickness. You want to have at least that or higher. You want to have a low deductible. So the requirement is for J1s that it has to be $500 per accident or sickness or less. We typically recommend looking for something in the $50 per accident or sickness, sometimes $100 per accident or sickness range. Mental health coverage is another big one. It's a very hot topic these days, especially with domestic and international students here in the United States. You want to make sure that if you do in fact have a mental health condition, that you check the policy that you're purchasing and make sure that it does have mental health coverage. Maternity and pre-existing conditions, these are two of the top claims that we see for international students and scholars here in the US. So if you are bringing your dependent with you here, and you plan on having a baby while you're here in the United States, you want to make sure that you have coverage for not only maternity, but pre-existing conditions as well. Last but not least, these kind of go together. Emergency medical evacuation and repatriation of remains. Again, we talked about it earlier. You have to have at least $50,000 for medical evacuation and $25,000 for repatriation. We do recommend having higher limits than that, as we mentioned earlier, and I skipped this one here, but again, prescription drugs is another big one. If you have a pre-existing condition or you have a condition that requires you to take medication, you want to make sure that you have prescription drug coverage in that plan that you choose, and we're going to get into that in a little bit. So before we get into the actual plans themselves, we want to tell you the plans that we have available for you. The 4 of the plans that you see up here: Essential, Bronze, Silver, and Gold, and they go in that order. So coverage ranges from more limited coverage with the Essential, cheaper coverage, and as you get towards the Elite, that's the most robust, comprehensive coverage that we have available for you. And now I'm going to hand it over to Eunice, and he's going to talk to you about the website that we have created specific for the international students and scholars at Southern New Hampshire University. I have it up on there.
Hi everyone.
And you don't need this.
So this is the website to enroll in those plans. It's the link is www.galvesstudent.com/snhu. First things first, before you do anything, you need to create an account before you can access the enrollment form. Here on the upper right-hand corner, you see student login. Click on that. Then need help logging in or create an account. And you fill up this create account form. You need to choose a username, password, confirm your password, student ID number, confirm your student ID number, first name, last name, email, and confirm your email.
And Eunice, can you explain to them this question mark we have here next to student ID as far as what we'll be looking for them to fill out for that?
So the question mark basically just tell you some idea how your student ID number should look like. And I think in your case, your student ID number structure is 7 digits. When you create your account, just add 2 zeros before those 7 digits. So make it 00 plus the 7-digit number.
And that's because we require all of our schools that we work with or offer insurance policies to have 9 digits across the board. So yours is currently 7. You want to make sure you add those 2 zeros to the front of your 7-digit number to make it 9 in total.
Yeah. And so once you click on the create account number, you will be able to use your username and password to log in. I'm just going to use mine here so I can show you the enrollment form. Wrong one.
Super user.
And here it is. So once you log in, you click on Enroll Now on the left-hand side, and here is the enrollment form. So basically, it's just your demographic information, date of birth, gender, email address should be there, your home country address, and the host institution information, which should be Southern New Hampshire University. It's all depopulated there.
And Eunice, can you go back up to the second section there? Scroll down a little bit. The home country address. We want to make sure we go over what visa type the student or scholar is.
Yep. It should be either F1 or J1. And something I would like to mention here, if your address has any special characters, do not put it on those fields because the form will not allow you to go any further. So if you have like an apostrophe or like a comma or like any other special characters, it shouldn't be used there. And once you get to this section, you can choose from one of these 4 plans. It goes from the cheapest plan as the essential plan through the elite plan. For the last section, the beneficiary first name, last name, this should be for your AD&D, your insurance, your life insurance. That's included in this policy.
And that life insurance benefit, it's called an accidental death and dismemberment benefit. And so if something happens to you while you're here in the United States, you happen to pass away, there is a lump sum benefit of $10,000 that will be paid to your beneficiary. So that's why we ask for that there. so that if something does happen to you, we're able to send a check to your beneficiary.
So it's important to put their information in this form. And the last one should be selected type, either student only or spouse if you have children, or spouse that you need to be enrolled in this policy.
So if you have a J2 or an F2 dependent here in the United States with you, you want to make sure that you're enrolling your J2 or F2 dependent while you're enrolling yourself. And you want to make sure that your J2 or F2 dependent has the same dates of coverage as you. They need to be insured for the duration of their stay here in the United States, just like you do.
So once you do that, you click on the continue button, and then you will be able to submit your payment instructions. And if you need any assistance filling up this form or creating an online account, you can always reach out to our customer service team, either by using the live chat. You will always find a customer service representative on the other side that can help you with doing that. Or you can always call us. Click on the customer service link, and here's toll-free number.
So you can contact us via telephone, you can contact us via email, or you can contact us via live chat. So if you're having trouble filling out an enrollment form, if you're having trouble logging into your account, if you're having trouble accessing your ID card, if you have questions about your coverage, you want to know if something's going to be covered if you're going to a doctor, you want to contact our customer service department. They're available to help you Monday through Friday. I believe it's 8 o'clock in the morning until 8 o'clock in the evening Eastern. And so please, if you have questions, we want you to call us so that we can help you.
And something I want to mention, that the duration of processing this form should be between 3 to 5 business days, and that's when your ID card will be available. If you need to have, if you need some medical services, you can always download your verification of coverage letter from your online account, and you can always present that to your doctor's office. Also, once your form is processed, you will have to authorize your account in order to access your insurance information.
So we're going to show you how to do that.
Under My Accounts section, you will see Authorize Account. You will be asked to enter your student ID number and your date of birth. Once you do that, you will click on My Account section, and you will find a link say Generate ID Card, and another one for verification letters. If you have dependents, you will have another link say Dependents. I will show you that under My Account here. Account mode, and that's how it should look like. So enter the account details, which we don't have in insurance. This is just a test account. You should see all this information that I just listed.
So if you happen to have a dependent on your account, you'll see the dependent tab there. You'll be able to see exactly who's enrolled with you. You'll also have access to your coverage dates, your ID card, and your verification letter of coverage. And as Eunice mentioned earlier, it does take on average 3 to 5 business days to get you your ID card. So if you have an urgent appointment, you can contact our customer service and ask for an urgent update, and we can get you your coverage information. We can also get you a verification letter of coverage so that you can bring that with you to the doctor as well. And now I wanted to take this time to go over the 4 plans that we have available for you. So we created a one-page document for you that gives you a summary of the 4 plans and really a snapshot of what each plan covers. When we were talking earlier, we talked about the type of coverage you want to have while you're here in the United States. As you see, there are 4 plans. If you're going to be here in the United States on average for maybe 3 months or shorter, you can go ahead and enroll in one of these 2 plans, the Essential Plan or the Bronze Plan on the left-hand side. Those are more limited plans that are typically not going to cover you for things like pre-existing conditions, pregnancy. In some cases, some types of prescription drugs may not be covered. So again, these plans are cheaper. They're a little bit more limited. They're really intended if you either have a really good bill of health or you're going to be in the United States for a shorter period of time. If you're going to be here in the United States for any longer than 3 months, we really recommend that you take a look at our Silver and our Elite plans. These are our two best plans. They're the most comprehensive plans that we have available for you. And I wanted to go over some of the benefits of those plans. One of the key benefits of those plans is there's no maximum on the policy. So again, we talked about earlier, you need to have at least $100,000. These plans are unlimited. As far as the deductible, so if you go to the doctor, you have to pay $100 per accident or sickness.
And just to mention here, this is only one-time payment. The deductible, it's $100. After that, the insurance will cover you at 80%. And once you reach the $6,350, it will cover you at 100% with no deductibles.
And that's what your out-of-pocket maximum is. So if you reach an out-of-pocket maximum of $6,350, which you see there, or $12,700 for your family, at that point the plan would pay 100%. Again, one of the key things we want to stress when we're talking about these plans is we want to make sure that you are staying in the network, which is sponsored by United Healthcare. And we're going to talk about the network in a little bit. The prescription drug coverage that we have available on both of these plans, it works just like an employer plan and or a major medical health insurance plan. So you will have a card when you go to CVS, Rite Aid, Walgreens, Walmart, any of the above stores that do have a pharmacy. You want to make sure you bring your card because they will process it for you, but you will have a copay that you will need to pay when you go to the pharmacy. In some cases, depending on the drug, you may have to pay $15 at the pharmacy. In other cases, if they're tier 2, tier 3, or specialized drugs, you may have to pay some coinsurance out of pocket in addition to the copay. If you have pre-existing conditions, they're covered immediately. So, for example, if you have asthma and you buy one of these two insurance plans today, the Silver or the Elite plan, you will be covered tomorrow or today for your asthma. There's no waiting period on that. So if you have any type of condition, if you're pregnant and you buy this plan today, you will be covered on this plan today. Preventative services, this is a key benefit to you if you're going to be here in the United States for, again, any longer than 3 months. If you want to go to get a routine physical, a checkup, if you have any immunizations you'd like to get while you're here, you want to make sure that you buy one of these two plans because that will be covered at 100% and there's no deductible on that as well. So you go there, you get that for free once a year. Even if you don't get sick, you can still use this insurance plan for your routine care. We talked about the co-insurance. If you go to the doctor and you have a bill that is $1,000, the insurance is going to pay $800. You're going to be responsible for $200 in the case with the Silver plan. In the case with the Elite plan, if your bill is $1,000, the insurance will pay $900. You will be responsible for $100 of that bill. So again, if you plan on going to see a doctor, this is something you want to factor in because when you use the insurance plan, there are differences between the two, 80 and 90%. So you want to make sure you're looking at that when you are purchasing an insurance plan. And last but not least, we also include medical evacuation and repatriation, as we talked about earlier. That's where you find the global emergency services. So international students and scholars are covered up to an unlimited maximum on both of those benefits. So if something happens to you while you're here, the medical evacuation and repatriation benefit are unlimited. Now we want to talk to you about the network. So if you use one of these insurance plans, they're underwritten by United Healthcare. That's the insurance company. So in using that insurance company, you need to make sure that you're going to a doctor that is within their network. So on the left side of the home page we have for you here, there's a link called Find a Doctor. So if you're going to go to the doctor, we recommend using this link first, or you can call our customer service department and they'll find one for you. I'm going to have Eunice show you how this works.
Yeah. So for this part, you click on Find a Doctor link.
What's the name?
And for the network would be United Healthcare Options PPO network. And to find participating provider, you go to search for a provider, and you will be directed to the United Healthcare site where you can find one. First things first, you need to choose a zip code. Like in this case, it's 03106.
And it will default to wherever you're currently located. So if you have your location services turned on to your phone, or if you're logged into your laptop or home computer, it typically will reroute to wherever you currently are located.
Just in case it doesn't, you can always click on Change Location and enter your zip code right there. So let's choose like another town like Manchester here, update location, and let's say you would like to look for hospitals, clinics, or labs. Click on this image. And you will get the results of all the facilities within a certain mileage.
And you want to look on the right for the check mark. So these are considered all in network. They all have a green check mark next to it, which means they will accept you if you bring your insurance ID card with you to your doctor's appointment.
So in this one, I choose the distance within 20 miles, but you can always change that. Let's put just 5 miles here. And here are the results. You have like 6 facilities, I'm sorry, 2 hospitals within the network here. You can always call them and schedule an appointment. And same things for the pharmacies. You can always click on Pharmacy Program, and UHC, go to UHCSR.com, or you can call that phone number, 1-855-828-7716, and they will be able to assist you to find a pharmacy in area. And most participating providers are like CVS, Walgreens, Walmart, Rite Aids. They're within the network.
And we want to talk about the voluntary dental.
Yep. Also, we offer a dental program for the Southern New Hampshire University students and scholars. You click on the voluntary dental on the left side, and the dental program is offered by Emeritus. And just to look for a quote, click on Enroll here. And you choose your school from the drop down. And you click on the next button. And here's the quote.
And with all of, again, this is a voluntary plan, so you do not need to enroll in this insurance. It's not required of you. But if you do have a tooth condition, or you want to go to see a dentist for routine cleaning or any type of preventative care that's not the result of an injury, this is available for you. And with that, you also have the option to add vision coverage to your dental coverage. It's $7 on top of it. The one caveat is that you cannot buy vision without dental. They do come together. It's a package. So you have the option to add that as well. If you have glasses, if you have contacts, and you want to go see an eye doctor, you can add that to your coverage here.
And the good things about this policy that you can purchase it this month, and if you don't want it anymore, you can always cancel.
So you truly can only buy this if you need to use, if you need to go see a dentist. So you can buy this for 1 month. You can go see a dentist. You don't need to buy it every month like you would with a health insurance plan.
And there's 2 options here, the indemnity one and the classic network. So for the second option, you will be limited to specific dental providers versus the first one that you can choose any provider, and they can submit the claims to Emeritus to pay it.
So we recommend If you're going to buy one of these plans, you look for the indemnity plan, the first one you see on the top there. It is a little bit more expensive, but you can go to any dentist. You don't need to stay within a network.
And if you click here to review the brochure, it will provide some information about what is covered exactly under this policy. So for the preventative services, include exams and cleanings for the first 2 years, covered 100%. For the basic services, for the first year, including fillings, x-rays, oral surgeries, and simple extractions, for the first year, 65%, the second year, 65%, the third year will be at 80%, and there's a calendar year deductible of $50. And this is the vision insurance, the optional vision insurance, if you would like to opt for it. And this is for an additional $7 per month. And the policy pays 100%. There's no waiting period, so it's covered from day one. And the policy pays 75% for lenses, frames, and contacts. And there's a waiting period of 15 months. And there's a $25 deductible per calendar year.
And I think that's it on that. You're good.
If you go to the second page, you can read about the dental limitation and exclusions. So basically what is not covered under this policy. Personal property, maybe?
Yeah, and you can show them the personal property too.
And we also offer a personal property insurance. On the right-hand side, click Learn More.
And on this homepage, you can learn about what the personal property insurance actually covers. Really, to keep it simple, there's a variety of plans that you can purchase here that range in price from cheap to expensive. If you have expensive things like iPhones, iPads, laptops, any type of expensive electronics, these are really good plans. They're often better than a plan that you would get through a renter's insurance policy if you happen to live in an apartment, or a homeowner's insurance policy. So if you have valuable items that you'd like to insure, this is the website for you here. It's really easy to enroll, and that's all we're going to go into the personal property for you today. We also left flyers here on campus, so if you want to stop by the office and grab those, they'll be available for you here too. And last but not least, the final thing we'd like to leave you with today, and it's a common theme that we see with all international students and scholars and a lot of insurance plans and how they operate here in the United States. The number one problem we see is that students forget to bring their insurance card with them to the doctor. So I want to make sure that we leave you with today. Make sure that you, number one, have your insurance card with you at all times, or have a picture of your insurance card saved to your iPhone. Number two is if you're going to go to the doctor and it's not an emergency, so if it's not life-threatening, you don't need to go to the emergency room, you just feel sick, please call us. There's a number on the back of your ID card. Ask to see a doctor, ask for an appointment. They will make the appointment for you, and also you'll be able to go see a doctor very quickly. They'll make sure that you're in network. That is the best way to use the insurance, so just make sure you have that card with you at all times, or a picture of it.
And just to mention, this policy will cover you everywhere in the United States, so there's no exceptions. If you go to Texas, you will be covered. They have networks there. If you go to California, you will be covered. So everywhere in the States. So outside of the United States, you will be covered except in your home country. So the level of coverage will be at the out-of-network level. So basically, if you go out abroad, you pay for your medical expenses, and when you come back to the States, you submit the claims for reimbursements. And on the left side here on the website, you will see claims company. So UHCSR is, yeah, it should be UHCSR, United Healthcare Student Resources. All the information will be on the back of your ID card, including their phone number and their email address as well. You can always get in touch with them, submit the claims, your receipts. Make sure to keep a copy of the receipt for yourself just in case it's lost in the mail. And the claims may be processed within 90 days from the receipt of from the reception of the claims.
And that would be in a case where you pay out of pocket for your doctor's visit because you did not bring your insurance card with you. So you want to make sure you bring that card with you, and you will not need to follow this reimbursement process.
We're talking about the abroad one. They will have to pay.
If you do go abroad, you will need to pay out of pocket. So in the case where you go on a study abroad trip, or you happen to travel, if you go on a spring break trip, or you go on vacation, you can still use this insurance, but you will be required to pay out of pocket. So if you're here in the United States, bring your card with you. If you go abroad, you may be required to pay out of pocket.
But again, this policy will not cover you in your home country. Anywhere in the world except your home country.
And that is all we have for you today. Thank you for your time.
Okay.
And if you have any questions, please feel free to call Gallagher. Again, the customer service link is on the left side of the page.
Yep.
Any questions at all, please call us. We're here to help you.
Yeah,
Thank you.
And the phone number again is 877-320-4347. Or you can use the live chat or the customer service form. Thank you very much for having us, and have a great day.